I didn't have this worry or this fear that during the night something was going to happen to him. I felt comfortable. I knew that he was in good hands.
What the staff did here provided us with great peace of mind because they proved to us time and time again we could trust them to take care of Dad as a person, to be aware of his dignity, meet his needs, despite the fact that his needs were substantial because of his dementia.
Who wouldn't want the best care for their mother or father? And at Suburban Hospital, that is what we're able to provide. Niche is the only program in the United States that is specifically designed to improve the skills of hospital nurses in the care of geriatric patients.
I'm going to be giving a report to Denise. She's coming in to take care of your wife for the night.
Niche stands for Nurses Improving Care for Health System Elders. And about 300 hospitals in the country have gone through this program to increase their staff's knowledge of the specialized care of the geriatric patient. Now for Suburban, this was a particular interest because we looked at our patient demographics to see what special populations do we take care of. And the demographic that stood out to us was our older patients.
Here at Suburban, the nurses have received the niche training, which is helping them understand the older adult. You know, the older adult has very specific needs, different than the young adult or middle-aged person. So we started very basic here at Suburban. We started with training the nurses on what is normal aging and what's not normal aging. And then we took that into simulations and sensitivity training to let them feel what it feels like to have a hearing deficit or inability to walk, pain in your feet, or an eye problem. All right, Carlene is going to be everybody. She's going to be an 87-year-old female who is very awake and alert. So she has a little bit of hard of hearing in her left ear, or she has a little bit of neuropathy in her fingertips. So this is the little start of Carlene's cataract that she has. How do you feel?
I can't see.
You can't see over
can't see on
to
my
me.
Right. Nothing
So
on my
you
right.
can't see on your right. Can you hear me well if I'm over here?
No.
What can you see out of those glasses? How much vision do you have?
Very little. I can only see directly in front of me.
Directly in front. We've gotten the training right down into the level of where the patients are so that they can learn how to interact appropriately with them. Now, what's happening? Why can't you just, you're not
Everything looks like
disabled.
peaches.
So everything looks like peaches. And what's one of the things wrong with the tray? What does anyone say? What's wrong with the
It's
tray?
all white.
It's all white. So we try to make sure that the patients have a little bit of color contrast on their tray. The sensitivity training has really opened everyone's eyes, mine included.
I'm not normally hard of hearing, and it's hard to focus on what you're saying and where it's coming from, and I can't see it all out of this one side of my...
And what can you see?
A little bit of just your face. I can't see anything.
So you can't,
Below your chin.
You can't see the spoon coming
not at all.
you.
You say you're from the Philippines?
Oh, yes, sir, I am.
I used to work for Southwest Airlines.
Oh, really?
One of the things that we've asked the staff to get involved in is connecting with the patients. Our patient population is only here for a few days, so we need to connect and get to know our patients fairly quickly.
I think one of the biggest things the staff showed was compassion for my father as a patient and for us as a family. They treated him as you would want to be treated yourself. And you can't ask for more than that.
The benefits of the niche program for the patient is that the entire nursing staff has an enlightened awareness of the special needs of this population.
We trusted them to do the right thing by him because we just saw it so often, so consistently. It provided great peace of mind.
One of the quick and easiest things for us to do for our older adults and for staff to see some of the positive changes that we can do to take care of the older adult was painting hallways. We painted hallways so that we could mark door frames for older adults as they walked down the hallway. They could identify their rooms easier. We cleared our hallways out so that they could reach a hand bar to ambulate. Our bathrooms were white walls with white floors, white toilets. So, and we realized when they got to that doorway that they would lose their depth perception, which we didn't know before this training. So we painted the walls to identify that toilet and sink and floor for them so they could have an easier transition coming into these rooms.
One of the things that we were particularly interested in working on was decreasing our falls, because we knew that falls had potentially such a serious implication for an older patient.
We have made a commitment with these low beds that we have brought into the hospital. They go very low to the floor so that patients can transition out of bed very easily without falling. They also have an alarm on them, so if someone is forgetful to call the nurse, that we can be signaled when they're trying to get out of bed, and a nurse can be right there for safety. We use yellow socks as a symbol between departments, nurses, and families, knowing if someone is a falls risk, that we can identify them right away. All of these changes add up to a safer environment for our patients and their families here at Suburban Hospital.
When my husband was a patient at Suburban Hospital, I just was so comfortable with him being there. The nurses, the staff, the care was so wonderful. Even with me, I mean, they would sit and talk with me. They did not let him lose his dignity. I never felt that, no one cared. There was always someone coming in. If we hit the buzzer, they came in, they took care of him, and pleasant. And it was just wonderful.
Do you want some more juice?
I am so grateful for the wonderful care that Jack received while he was at Suburban, because now he's home with me where he belongs.